I'm Carrol Esterhuizen, Doctor of Physical Therapy at Albany and Corvallis Sport and Spine Physical Therapy with my colleague Kindra McDougall, and we're going to show you how to do a shoulder flexion pulley exercise correctly. We see many shoulder patients in our clinic after surgeries and after they've had rotator cuff repairs or slap repairs or shoulder replacement surgeries. This is an exercise that doctors typically have patients do between 6 to 8 weeks after their surgery. You have to wait for your doctor to give you the okay before you can do this exercise, and you have to be shown this exercise by your physical therapist before you initiate the exercise. We're doing this to show you how to do the exercise correctly and also for an educational purpose for our own patients that come into our clinic. So when you do the shoulder pulley, you want to make sure that your arm is in a 45-degree angle with your thumb facing upwards and not down in this direction, because that is more comfortable for the shoulder. This exercise is basically called an active assisted exercise, and you're doing most of the exercise with your unaffected arm. Your right shoulder or your surgical shoulder is just along for the ride. We're going to have her raise her right arm by pulling down with the left side. And when you come down from this position, you want to give yourself resistance on the opposite side because you're slowly lowering this arm. Not just letting it drop down, because that would not be comfortable for a surgery, for a post-surgical shoulder. And gently lower down. Good job, Kindra. Now we're going to show you the way that you don't want to do it, and oftentimes patients do this by hiking the shoulder up and pulling up. That puts too much strain on your neck also. We don't want you to do that, and it teaches your body wrong habits. Slowly up and slowly down. This is an exercise you'll only do 10 times, 3 times a day, especially initially, because it's not something you want to do over and over on a acutely operated shoulder. And follow the instructions that your physician and your physical therapist give you.